Hey everyone, welcome back to What's Going On Now, your place for real talk on current events, health updates, politics, sports, and everything in between. Former U.S. President Joe Biden has been diagnosed with metastatic prostate cancer, a stage of cancer that has already spread beyond the prostate gland. This announcement has brought both concern and curiosity from the public, especially around what this means for his health, the severity of the diagnosis, and what this teaches us about prostate cancer in general. Start with the facts. According to NPR and several other news outlets, President Joe Biden has been diagnosed with an aggressive form of prostate cancer that has metastasized, or spread, to his bones. This was a shocking announcement to many, especially because the diagnosis came after he had already left office, and he's currently 82 years old. Reports indicate that the cancer is hormone sensitive, which means doctors can still treat it with a number of available therapies, and that gives hope for effective management. His office released a statement saying the former president is in discussions with his medical team to determine the best course of treatment going forward. So what exactly is metastatic prostate cancer? Let's break it down. The prostate is a small gland in men that helps make semen. Prostate cancer occurs when cells in the prostate start growing uncontrollably. In its early stages, prostate cancer often grows slowly and can be treated or even cured. But when it becomes metastatic, that means the cancer has spread beyond the prostate to other parts of the body, like the bones, lymph nodes, or even vital organs like the liver or lungs. In Biden's case, the cancer has reportedly spread to the bones. That's serious. Bone metastasis can lead to pain, fractures, and other complications, but it's also treatable. Now here's something you might not know. Prostate cancer is one of the most common cancers in American men. According to the American Cancer Society, an estimated 313,780 new cases of prostate cancer will be diagnosed in the U.S. in 2025 alone. About 1 in 8 men will be diagnosed with it during their lifetime. But here's the key. Most prostate cancers are caught early, and that's why survival rates are relatively high. The overall 5-year survival rate for prostate cancer is around 97% when it's localized or regional. However, and this is critical, once the cancer spreads to distant parts of the body, like bones or organs, the survival rate drops to about 37%. That's a dramatic change. So Biden's diagnosis is in that tougher category, but it's not without options. There are several treatments available for metastatic prostate cancer, and the best option depends on the patient's health, the cancer spread, and how aggressive it is. Here are the main strategies doctors may consider. Hormone therapy, androgen deprivation therapy, ADT. This lowers testosterone levels, which fuels the growth of prostate cancer cells. Since Biden's cancer is hormone sensitive, this will likely be part of his treatment. Chemotherapy. Drugs like docetaxel are used to kill fast-growing cancer cells throughout the body. Radiation therapy may be used to target areas of bone where cancer has spread, especially to relieve pain or slow progression. Immunotherapy, or targeted therapies. In some cases, patients are eligible for treatments that boost the body's immune system to fight cancer. Clinical trials and experimental drugs. At Biden's age and status, his doctors may also consider enrolling him in cutting-edge clinical trials. Dr. Ben Davies, a urology professor at the University of Pittsburgh, commented that Biden still has many treatment options, and that his age alone isn't necessarily a reason to avoid aggressive treatment. What matters most is his overall health and whether his body can tolerate it. Biden's diagnosis brings attention to a topic many men don't want to talk about: prostate health. It's no secret that men are often less likely to go to the doctor or get regular screenings. But prostate cancer, if caught early, is one of the most treatable forms of cancer. This moment is a chance for encouraging men over 50, especially Black men, who face a higher risk, to get screened, promoting PSA blood tests and digital rectal exams, even if they're uncomfortable, reminding families to talk openly about health and aging, particularly when it comes to men's health. In a way, this could become one of Biden's most important public health moments, even if it's a deeply personal one. Of course, the fact that this diagnosis involves a former U.S. president adds another layer to the story. Joe Biden is one of the most recognized political figures in American history, having served for over 5 decades in public service as a senator, vice president, and president. Whether you agree with his politics or not, this diagnosis reminds us that cancer does not discriminate. It doesn't care about power, wealth, or fame. It affects everyone, from everyday folks to world leaders. His family has reportedly rallied around him as he navigates his treatment decisions. For now, Biden is out of the public eye, taking time to reflect, consult doctors, and focus on his health. So, what do we take from this? First, prostate cancer is common, but not always deadly, especially if it's caught early. Second, Biden's diagnosis is serious but treatable. There's still hope, especially with today's medical advances. And third, this is a wake-up call. If you're a man over 50, or you have one in your life, get checked. Have the conversation. Your life could depend on it. That's it for today's episode of What's Going On Now. If you found this video informative, make sure to give it a thumbs up, subscribe for more Real Talk updates, and share this with someone who needs to hear it. Until next time, stay informed, stay aware, and take care of your health.